Welcome back, everyone, to another MedVarsity Deep Dive. Today, we're going deep into the world of computational pathology. Ever wonder how technology might personalize cancer treatment?
Yeah,
Get ready, because this is some seriously cutting-edge stuff.
it really is. What we're talking about has the potential to change how we approach cancer entirely. I mean, from diagnosis to treatment
Wow.
and even prevention.
Okay, let's start at the basics. We all know cancer is a big problem, but what are we talking about in terms of numbers? Like, how big of a problem is this, really?
Well, the prevalence of cancer is staggering. It's estimated that 1 in 2 men and 1 in 3 women will face a cancer diagnosis in their lifetime.
Yes, that means.
That means almost half of the adult population could be affected.
Yeah, that's a sobering thought. But if the diagnosis rate is so high, why isn't the death rate equally alarming? Are we getting better at treating cancer?
Yes, we are. There have been significant advancements in treatment, especially with immunotherapy,
Hmm.
but
Okay.
we're also overtreating. Take prostate cancer, for example. It affects 1 in 7 men,
Wow.
but only 1 in 40 will die from it.
So you're saying.
This means
Yeah.
thousands of men are undergoing potentially harmful treatments they may not need.
Hold on. So you're saying some men are getting treatments that might actually do more harm than good.
Yeah.
That's a scary thought.
It really highlights the need for a more personalized approach to cancer treatment.
Right.
And that's where computational pathology comes in.
All right. So what exactly is computational pathology and how can it help?
Think of it this way. It uses artificial intelligence to analyze medical images and data,
Okay.
providing doctors with a deeper understanding of your individual cancer.
So instead of a one-size-fits-all approach,
Yeah,
we're talking about tailoring treatment to each patient's unique needs.
exactly. For example, AI can analyze scans to determine the risk of a cancer becoming more aggressive or spreading.
Oh, wow.
It can even predict how a patient might respond to different therapies.
Wait, so you're telling me a computer can look at my scans and potentially tell me what treatment will work best for me?
Yeah,
That's mind-blowing.
it is. It can detect these subtle changes in cell shape or arrangement that correlate with aggressive behavior, something even expert pathologists might miss.
That's incredible. But what about existing tools like the Oncotype DX test?
Yeah,
Don't those already personalize treatment to some extent?
they do, but they have limitations. They often involve destructive tissue testing, which means parts of the tumor need to be removed for analysis.
Oh.
And this runs the risk of missing the most aggressive parts of the tumor, leading to potentially inaccurate risk assessments.
Okay, so AI could overcome those limitations by analyzing digital images of the entire tumor, potentially providing a more complete picture.
Right.
That makes sense. But how does AI actually learn to make these predictions? Are we talking about some kind of supercomputer doctor?
Not exactly. It's about data. AI algorithms are trained on massive data sets of patient information, including images of tissue slides, genetic information, treatment outcomes, and more.
So it's like giving the AI a crash course in oncology, but on a scale that's impossible for a human to absorb.
Exactly. And as the AI analyzes this data, it begins to identify patterns and correlations that help it predict how a particular cancer might behave.
That's fascinating. So are we talking about something that's still in the research phase, or are there actual real-world applications of this technology today?
We're actually at a very exciting point where research is rapidly translating into clinical practice.
Yeah.
There are already FDA-approved AI-powered tools being used by pathologists to improve diagnostic accuracy.
So AI is already helping doctors diagnose cancer more effectively. That's great news.
It is, but it's important to remember that diagnosing cancer is just the first step. What's even more exciting is AI's potential to go beyond diagnosis
Right.
and predict how cancer might progress
Yeah.
or respond to treatment.
That's what we were talking about earlier. So how is this actually being used in practice?
Yeah.
Are there specific examples?
Absolutely. There are emerging AI tools showing real promise in predicting the aggressiveness of prostate cancer based on biopsy images.
Okay, so walk me through this. How would this work for a patient diagnosed with prostate cancer?
Imagine this. You've just been diagnosed with prostate cancer, and your doctor wants to determine the best course of treatment. Instead of relying solely on traditional methods, they can now use AI to analyze your biopsy images and provide a more precise assessment of your risk.
So AI could potentially help doctors decide which patients need immediate aggressive treatment and which ones might be candidates for active surveillance. That could spare some men from unnecessary interventions and side effects.
Exactly. It's all about moving away from a one-size-fits-all approach and tailoring treatment to the individual patient. And it's not just limited to prostate cancer. Researchers are developing AI algorithms that can analyze tissue slides to predict things like the likelihood of a tumor recurring after surgery,
Oh, wow.
or the chances of a patient responding to a specific chemotherapy regimen.
Wow, this is starting to sound like science fiction becoming reality. It's incredible to think that we're moving toward a future where cancer treatment could be as unique as the individuals receiving it.
It is, and it's not just about treatment. AI can also play a critical role in early detection.
Okay, so we've talked about diagnosis and treatment. Now we're getting into prevention.
Right. Imagine if we could identify individuals at high risk of developing cancer long before any symptoms appear.
That would be a game changer. Early intervention is so important when it comes to cancer. But how could AI possibly predict something like that?
AI could analyze a wide range of factors, from genetic predispositions to lifestyle choices and environmental exposures, to create a personalized risk profile for each individual.
So you're telling me a computer could potentially tell me if I'm at high risk for developing cancer, even before I have any symptoms. That's both amazing and a little unsettling, to be honest.
It's understandable to have mixed feelings about such advanced technology, but the potential benefits are enormous. Think about it. Knowing your risk factors could empower you to make lifestyle changes
Right.
or consider preventative measures
Yeah.
that could significantly reduce your chances of developing cancer.
I see your point. It's all about using this technology proactively to stay ahead of the disease rather than just reacting to it after it's already developed.
Exactly. It's about shifting the paradigm from reactive care to proactive prevention, and AI could be the key to making that happen.
It seems like the possibilities with AI and computational pathology are endless. What other applications might be on the horizon?
The potential is truly vast. For example, imagine AI helping us develop entirely new therapies, not just by targeting specific genes or proteins, but by understanding the complex interactions within the tumor microenvironment.
It's like we're entering a new era of scientific discovery, and AI is leading the way. But with all this incredible potential, aren't there concerns about the role of human expertise? Are doctors and researchers going to be replaced by robots?
It's an important question. But the reality is that this isn't about replacing human expertise. It's about augmenting it. Doctors and researchers will still be at the heart of cancer care, but with AI as a powerful ally.
So it's about combining the best of human judgment and compassion with the analytical power of AI to create a future where cancer is no longer the formidable foe it is today.
Precisely. And that brings us to something important for you to consider. We've been focusing on the role of AI in analyzing images and genetic data, but what about the human element? How do we ensure that this technology is used responsibly with patient well-being at the forefront?
That's a crucial question. As we embrace the power of AI, we need to be mindful of the ethical implications and ensure that this technology benefits all of humanity.
Absolutely. The future of medicine is a collaborative one where technology and human compassion work hand in hand to create a healthier and brighter future for everyone. This deep dive has been truly eye-opening, and I think we're all leaving with a sense of both excitement and responsibility as we step into this new frontier of medicine.
It really feels like we're on the cusp of a paradigm shift in how we approach cancer care. But with any powerful technology, there are always concerns about accessibility and equity. How do we make sure that the benefits of AI and computational pathology reach everyone, not just a select few?
That's a critical question. One of the biggest challenges we face is ensuring that these AI tools are accessible to all patients, regardless of their socioeconomic status, geographic location, or the resources of their healthcare system. We need to bridge the digital divide in healthcare and make sure that these advancements are available to everyone who needs them.
It sounds like there's a real risk of exacerbating existing healthcare disparities if we're not careful.
You're exactly right. We can't allow AI to become another tool that widens the gap between those who have access to cutting-edge care and those who don't. This is going to require a multifaceted approach involving investment in infrastructure, education, and policies that promote equitable access to this technology.
It's like we need to make sure the playing field is level so everyone has a chance to benefit from these advancements, regardless of their background or where they live.
Absolutely. It's about ensuring that the promise of personalized medicine becomes a reality for all, not just a privileged few.
This has been an incredible deep dive. We've gone from the sobering stats about cancer prevalence to the mind-blowing potential of AI to personalized treatment and even predict cancer risk. It feels like we're on the verge of a whole new era in medicine.
We really are. And what's exciting is that this is just the beginning. We've only scratched the surface of what AI can do in computational pathology. As we continue to gather more data and refine these algorithms, the possibilities will only expand.
Before we wrap up, is there one key takeaway you'd like our listeners to ponder as they continue to explore this fascinating field?
I think the most important thing to remember is that AI is a powerful tool with the potential to transform healthcare as we know it. But it's ultimately up to us as humans to guide its development and ensure it's used ethically and responsibly. The future of medicine is a collaborative one where technology and human compassion work hand in hand to create a healthier and brighter future for everyone.
That's a great point to end on. Thanks for joining us on this deep dive into the world of computational pathology. We'll see you on our next adventure into the frontiers of knowledge.